Good day and welcome to Restaurants Rise Food Safety. Today is the first in a series of sessions through the month of September for food service leaders to gather together to discuss best practices and solutions centered around food safety, guest and employee health, protocols, and new ways to approach what we all know is a constantly moving target as we all battle the continued coronavirus pandemic. Today's session will be about ensuring customer and employee confidence during COVID-19. And I know that we have lined up great speakers and there will be an engaged Q&A to come. I'm Sarah Lockyer, Group Publisher of Nation's Restaurant News, and I'm happy and very honored on behalf of Nation's Restaurant News and our long-term partner Ecolab to welcome you here today. It is our mission through Restaurants Rise to connect leaders and provide direct access to information, insights, and solutions to face today's challenges so we can all come out stronger than ever once we reach the other side. Partnering with Ecolab on this, specifically geared toward food safety in the month of September, is really a privilege, and there are few companies that count as true partners to the industry and provide excellent resources and insights to help your businesses grow. I'd like to invite everyone here to explore the rest of our content on restaurantsrise.com, which has been live since May and filled with insights you can view on demand at any time. I'd also welcome our food service operators to join us, along with our partner Ecolab, at the new Restaurants Rise, powered by MUFSO, which will be taking place throughout the entire month of October and on demand through the rest of the year. You can find out more at mufso.com. Now, I know Ecolab has a great session planned today and all through the month, so I'm happy to turn this over to Greg. But let me just say thank you for your leadership always, but particularly now as the industry faces unprecedented times. This is an excellent series and a great way to support the industry and move it forward. So over to you, Greg. Thank you.
Thank you, Sarah. Good afternoon, everyone. I'm Greg Cucciarella, Vice President of Industry Relations at Ecolab. And Ecolab is a global leader in water, hygiene, and energy technologies and services. Our vision is to provide and protect what is vital: clean water, safe food, abundant energy, and healthy environments. And we're excited to talk to you today about food safety, which is one of our 4 key pillars. Food safety is a top concern for restaurant guests and owners. So a strong food safety program in your organization is crucial to instilling confidence with your consumers, which will drive business and help protect your brand. As part of our commitment to furthering food safety, Ecolab has partnered with Nation's Restaurant News to host a series of 4 webinars during Food Safety Month. As an overview, through this webinar series, we will be providing practical information to assist you in building a strong food safety program to help the restaurant industry rebound during these challenging times. Today's webinar will focus on ensuring customer and employee confidence during COVID-19. Our second webinar will cover health inspections, what you need to know on your next virtual or on-site inspection. Week 3 will dive into new procedures and approaches to cleaning and sanitizing and disinfecting. And then our final webinar series will discuss new and emerging trends in the food service industry. So today's agenda will feature Dr. Ruth Petran from Ecolab. She'll be discussing managing COVID-19 risks during a recovery period. And then Molde from Datassential will dive into consumer insights and how it impacts your business. And then following the presentations, we'll host a Q&A session. So if you have questions throughout the presentation, please feel free to submit those down in the Q&A section, which is in the bottom right-hand corner of the WebEx window. We'll collect those questions, and then we'll have an opportunity to have an interactive Q&A towards the end. So as I mentioned, our first presenter today is Dr. Ruth Petran, Senior Corporate Scientist, Food Safety and Public Health at Ecolab. Dr. Ruth has over 35 years of experience in the industry, serving on multiple boards, supporting our industry and supporting our customers. We appreciate your time today, and with that, I will turn it over to Ruth.
Thank you, Greg and Sarah. and all of you for joining us today. I'm pleased to be kicking this off through the month and invite you to continue to join us for the wonderful schedule of webinars we have coming up. But let's get down to brass tacks today. Obviously, we are still in the midst of this terrible COVID-19 pandemic, but we need to live through it. And what I want to do is tee up the fact that I think there are great ways that we can do that and effectively manage these risks as we look to recover. Next slide, please. But first, some sobering statistics. There is a lot of illness out there. Globally, it's estimated that we have crossed the 27 million mark in numbers of people who have become sick and close to 900,000 deaths. Next slide. And the reality is this is still kind of a new illness agent, although it seems as though we've heard about it for a very long time. It's really only been a matter of months. And because of that, we're still learning new information all the time, and there's new research being done. So we really have some challenges in front of us of how do we best manage the risks related to this new illness agent that's still new. Well, the best way to do that is, frankly, to rely on the science and to rely really on classic risk assessment principles, which means that we need to identify the risks that are there and then figure out and implement the right ways to manage them. Next slide. And I think one of the biggest ones that we just need to keep in mind, and I want to make sure that we just keep this top of mind, is how coronavirus spreads. And although it does depend somewhat on the particular strain we're talking about, it is far and away through droplets from an infected person, that is someone who's sick, to somebody else. And those drops can come obviously from a cough or sneeze, from a conversation. If they get on a surface or on hands, they can be transmitted. If then that hand or surface gets to our mouth, nose, or eyes. But that virus needs to enter through our mouth, nose, or eyes, and then it impacts our lungs. And we know that person-to-person transmission is happening, but again, it's through these droplets. Please keep that in mind. Next slide. And it does bring us to the question of, well, what about through air? There's been, especially more recently, a lot of commentary and discussion about this, because we are seeing that it seems to be transmitted pretty efficiently through the air. Now, researchers debate this a lot, and there's a lot of research ongoing, but we need to keep in mind that the transmission is still from these infectious droplets, so that just air alone is not going to pose a risk. We also don't know what our infectious dose is to the virus. So what is really the impact of these airborne particles on causing disease? I think it's fair to say that aerosolation risks in everyday situations that we would encounter is very, very low. But where there are aerosol generating procedures, like in a healthcare setting, we have seen transmission. Given that there's still a lot of murkiness here, frankly, I think it's worthwhile to think about taking precautions, though, and making sure engineering controls related to air handling are in place. This may include ventilation, filtration, perhaps use of UV, with careful review to make sure that we're using those that will optimally reduce transmission. But none of these replace the need for following our standard kind of risk management practices that we've all heard about for months and months. Next slide. And we need to think about how these risk factors, that is from a person, can enter into our establishments through employees or our guests. And then it spreads around through these airborne routes or through touching these surfaces. Next slide. And there's some just reality that we know to be in place. We know that a great majority of all infections are transmitted by our hands. And we know that hand washing in particular can reduce the risk of respiratory infections. But the reality is that people don't wash their hands the way they're supposed to. Next slide. So we pull all of this information into these standard risk management strategies. Again, the things that we've heard about for months. CDC and the WHO continue to promote these, and I think it's really, really important that we all follow them. Things like staying home when we're sick and staying isolated when we're sick. Practice physical distancing, that is avoiding close contact where possible, wearing a mask where it's advised. Hand hygiene, washing our hands, making sure we're covering our mouth and nose, and then using cleaning and disinfection approaches to help reduce risks further. Next slide. So what about temperature monitoring? We talk about isolating ill people and the use of thermal scanners such as this handheld device that's shown here, or more sophisticated kind of walk-through devices. Can those detect COVID-19? Well, the short answer is no, but they can detect one of the symptoms. But we need to keep in mind that there are many other causes of fevers beyond COVID-19, and we may not see a fever in all cases. The symptoms listed here are quite variable and illustrate that there's quite a range of presentations that ill people may have, some of which look remarkably like other kinds of illnesses. So the takeaway for this is that we just need to be aware that there's a lot of different presentations that people may have with COVID-19, and we need to be very vigilant at looking for all of these and make sure that people who are experiencing these kinds of symptoms are not coming into our establishments. Next slide. Hand hygiene protocols are very important as part of the overall hygiene practices. Washing our hands frequently with soap and water is vital, and using hand sanitizer when soap and water are not available. We need to focus these around standard infection control practices, such as we've talked about. And this does include keeping our distance, using the right personal protective equipment, and then environmental hygiene as well. That is cleaning and disinfecting high-touch surfaces and objects with approved products, following the right kinds of procedures. Next slide. Now, we all know how to wash our hands, and I don't want to go through all the steps, but in these times, it's vital to be following all of these steps. And keeping in mind that if soap and water are not available to follow these standard 5 steps, alcohol-based hand sanitizers, as recommended continually by the CDC and the World Health Organization, do play a good role. Next slide. And there are many, many resources out there that can help you reopen and recover. We provide many of these on our website at ecolab.com/coronavirus. We have everything from reopening checklists. We have a series of webinars that we've done over the past months, and the ability to offer assessments to ensure that these kinds of practices are being followed. These can be used to enable your staff, providing cleaning procedures targeted against the most important areas, the right products that marry up with those procedures, supported by various promotions and training as well. Our Lobster Inc. offering provides many different programs and quick start options for your staff. And all of this collectively helps to assure guests using various signage and flyers and so on that can help reassure your guests that you are paying attention to the environment that they will be coming into. Next slide, please. It's all about restoring trust with your customers, and making hygiene visible is really the key here to really demonstrate that you are in control, that you have identified the risks, including from high-touch surfaces, that you're communicating what it is you want to do, and you're displaying these procedures, turning the invisible into the visible with those risk management strategies. Next slide, please. So what's really key is to consider the relevant risks that are related to how COVID-19 is actually transmitted, again, from these droplets. We know that sanitizers and disinfectants can certainly help to manage risk using the right product and using it properly. But it's very important that you verify that you are following the right procedures and consider calling on Ecolab as a way to offer help. Next slide, please. One of the ways that we are doing this is through a new offering called Ecolab Science Certified. It's an assurance program that helps to verify that the right programs, products, and procedures are in place to help ensure that higher level of cleanliness that we know is being demanded by consumers today. The idea is that we move from creating clean to checking and verifying clean, giving the consumers the opportunity to see clean in action, and then giving them peace of mind and belief that cleanliness is practiced. Next slide. And I'll leave you with the reminder that we do have a number of public health and food safety resources that are available. We have done a series of webinars for many, many years, and they are on demand related to a whole range of food safety and public health topics. And we have a resource library as well that can provide you various tips and readiness kits in response to outbreaks, for example. All of these can be accessed on our website. And at this point, I will turn it back to Greg.
Thank you, Ruth. Thank you for walking us through great information about how to manage COVID-19 risks during a recovery period. I'd like to now transition to our consumer insights section and I'd like to introduce Marie Molde from Datassential, who will now touch on consumer insights and the impact to your business. Marie is a food service consumer expert at Datassential. She has an MBA from Dominican University and is a registered dietitian. Marie brings a very unique perspective to share with us today. So welcome, Marie, and thank you for your time.
Excellent. Thank you, Greg, and thank you to everyone on the phone or on the webinar with us. I'm excited now to dive into consumer insights that we're facing right now regarding how restaurants and food service can kind of best bounce back and address issues from the pandemic. So what I'd like to start with here is this statistic. So Datassential is a market research firm. We are dedicated exclusively to food and beverage, and we've been tracking consumer insights and attitudes relating to the pandemic since it began in early March. So this question is not related to food, but just generally, what is your concern level about coronavirus? And we can see back in early March, 41% of the general population stated they were very concerned. We then saw that increase for several weeks. Most recently, we saw a steady decline until June and July when we saw cases begin to spike again. Then we saw concern spike along with that. And then also recently with the return to school happening in August, we know that parents and families are facing a lot of new questions and probably fears relating to that. So concern is on the increase again. But the real question for us and this audience is, does that concern manifest into avoidance of eating out and fear around going to restaurants? And what we find here is that concern has really remained steady throughout the pandemic. So today, 46% of us say we will definitely avoid eating out. That means going out to restaurants and getting food away from home. And that's also well above the levels as they were in March. So we can see 26% increase of eating out avoidance since the pandemic began. Now, we can also look at that data demographically. So see, is it men or women or which age groups are most avoiding eating out today? And this data is interesting because there's more of a gap here in that gender split between men and women than we typically see in our research when it comes to attitudes or perceptions or opinions here. So there's a 14-point difference between men's actions going out to eat and women. So women are 14% more likely to be avoiding eating out than men are today. We can also see there that boomers are the most likely age group to be avoiding eating out, which if there's one thing we've learned as we've been tracking this data, the at-risk groups have definitely expressed more concern and been avoiding restaurants more so than younger age groups. But definitely a takeaway here is that women are the most likely gender here to be avoiding eating out as compared to men. And also if we think about an operator audience, so operators are worried right now about surviving the pandemic. If we think about months ago, maybe the operator population was braced for more of a short-term situation here, and it's really been more longer-term probably than most or any of us expected. So right now, the majority of the operator population, 59% of operators across all food service verticals, are worried, but they're also confident that their operations will get through this. But we do see that kind of red stoplight group, that 13% of operators who are very nervous about this situation growing. So kind of 5% of people went from being worried to being very nervous since July. And that camp of operators, that 27% that do feel cautiously optimistic, they have largely remained that way throughout this situation. But they also happen to be operators from segments who are simply less affected by coronavirus, like the quick service restaurants, for example. So that said, we hear again and again, people are excited to get back to restaurants. They really want to be eating away from home for a number of reasons, from variety to socialization to just being able to support the restaurant community. And when we think about options for us to get food away from home, restaurants do top the list of where consumers feel safe today. So that's especially true if these restaurants have outdoor seating, or if they are a quick restaurant experience like that QSR fast casual operation. What doesn't yet feel as safe to us is the more kind of enclosed or maybe not even open establishments like concert halls or food halls or airport lounges. They're not quite feeling safe to us just yet. And let's take a look at this. So, we know that as humans, we're hardwired to kind of be resistant to change. Change is hard for us and unpredictability is hard for us, and that's what we're facing right now. So consumers are really stating a interest in having rules right now, like kind of tell us, give us guidelines and give us some rules. So 83% of consumers say that restaurants should require guests to follow safety guidelines. Now that's not specific to any particular guideline. It could be masks or distancing or any which one of them. But the far majority believe that restaurants need to be requiring that, whereas only about 1 in 3 of us say that restaurants should not be required, that kind of people are responsible for themselves and guests should be responsible for acting responsibly. Instead, we really want rules to be enforced by restaurants. And a lot of that is about communication, so not just having these rules sort of mysterious or, if someone walks into your operation, they're not sure what's being in place, that 80% of people today, so that's not a small minority, that's a large majority, say that they're going to be more careful to check if places are strictly enforcing safety precautions before deciding where to eat. So really important for restaurants to be overt about safety precautions that they're taking and really communicate that to your guests. And there are a number of options available today for guests to get that information. This snapshot here happens to be from the COVID comfort ratings for Orange County area. So there's a food critic publishing this list every week of restaurants, and it seems to be only independent restaurants that he's visiting, but he rates them on these metrics from temperature checks to masks to outdoor indoor dining or sanitization of tables and chairs. So quite an exhaustive list. There's also a paragraph about his experience there. So just one of many examples for consumers to find information about how restaurants are doing. And in this particular situation, the restaurant is given a grade from A through F based on its comfort rating for that critic. So we also compiled a number of public reviews, all from full-service restaurants, but public reviews that consumers have written online about their own experience in food service these days. So this one was positive, and I'll just read it quickly. It says, "This place was delicious and very clean. The reopening is amazing. The menu is scanned to your cell phone. The payment is pretty much hands-free. During this pandemic, they've done an excellent job with social distancing in all dining areas, and the busboys are cleaning champs. They sanitize all tables and chairs after every customer is gone to give the new customers a calming, comfortable dining experience." So within all the public reviews we kind of found and collected and read, what's mentioned here seems to be the key themes of them. Really, it's about having that overt sanitation where you can see that tables are being wiped down, or certainly that the restaurant is taking actions towards sanitation and cleanliness. Also about masks, also about distancing. Whereas these negative reviews, so again, this is from a full service restaurant posted online. This one says there is no social distancing happening when you pick up your order. None of the employees are wearing a mask. This place is a COVID trap waiting to happen. Do not order food here. They're not prepared for the demand or have a safe system in place. I would like an explanation from the owners as to why they are putting customers at risk, not following guidelines to wear a mask. So again, when we look at the summary of the negative reviews, this one is a good representation of all of them. It was, no matter what kind of occasion it was, if it was curbside pickup or dining in, consumers seem to notice like their server was wearing a mask or not, or the person who brought their food to their car had gloves on or not. So point being, people are really noticing today, and we think this notion of overt sanitation is really important, like almost that you can't be too obvious about the measures that you're taking, and people are really noticing that. So as I mentioned, our business, we've been around for 20 plus years. We've conducted a lot of food and beverage surveys in that time. And one interesting thing that's happened during coronavirus is in the past, no matter what you were asking, what is the top thing you want from a food and beverage experience or from a new restaurant? Taste and flavor and great taste is always number one. We know that as an industry that taste is king, but during this time, great taste has been displaced for the first time that we've tracked by the notion of the restaurant being clean and sanitary. So that's definitely of utmost importance to consumers today. And we also think it has legs moving into the future. So it's not just at this point in time as we deal with this pandemic, but that as we move through it and past it, sanitation is always going to be more important than it was before. And this data supports that. 76% of consumers say a restaurant's cleanliness and food safety procedures will always matter more to me than they did before. And here's data that shows, thinking about the chain restaurant landscape, we have a tool that tracks chain restaurants across a number of different metrics, cleanliness ratings being one. And here we can see that the chain with the top rating in cleanliness gets a 81%, and the bottom ranked chain for cleanliness gets a 35%. So quite a drastic range there, meaning that people are really noticing cleanliness and really ranking restaurants differently. So just another data point to support that this is something we should all be thinking about. And safety, trumps everything. I think I can't echo that enough, and I'll continue to say that as I run through this presentation. But, before the pandemic happened, we thought sustainability was going to be our big theme this year as a research firm, with everything happening with climate change and consumer perceptions of sustainability. But today we can see that in the situation we're in, safety is trumping everything else. So sustainability versus safety, 78% of consumers are thinking more about safety today, or safety trumps visiting your favorite restaurant, or having healthy items, or having something that's affordable even, that safety is really our number one thing. So the three safety elements that are probably most important to think about, the top three attributes that make consumers feel safe dining in, are the highlighted attributes here. So having the common areas visibly wiped down regularly, having spaced out tables, and having employees wear masks. Those are like the three table stakes items. But you can see here that nothing is really too much or too far out there. It's everything from the restaurants being extremely clean to having contactless payment available to having individually wrapped items, or lots of different things here are items consumers are thinking about when it comes to safety. But this visible sanitation, the spacing out of the tables, and the mask wearing is really something we can't get away without. And then also, and Ruth touched on this as well, the importance of communicating the measures that you're taking when it comes to safety. So safety here, the measures restaurants are taking to ensure food safety is the number one thing consumers want to hear about. And, think about your audience here, what kind of customers come to your operation, because we do know that some people prefer to hear from restaurants through different methods. So boomers tend to like to hear from restaurants through email. Millennials prefer social media, and Gen Z often prefers going to the restaurant website directly. But remember to communicate the safety efforts that you are making during these times. And then mentioning that contactless was important. So certainly contactless is a key word coming out of all of this. We think diners will continue to opt for contactless methods as much as they can. Here in green, we're seeing data that consumers say they plan to do more of once our restrictions are lifted, and in black is data that we plan to do less of. So what we plan to do more of is things like going through a drive-through, or calling to place an order, or using an app to place an order, very contactless methods. Whereas what we plan to do less of are eating inside of a restaurant or ordering at the counter, which requires more human interaction. And certainly this touches back to we know that air transmission is something we need to be mindful of, and that we've seen the fear of consumers regarding coronavirus kind of transfer from initially we were afraid of touching things other people had touched, and now that's more so fear of being around other people because we've learned more about the transmission. And then also takeout and delivery is such a big deal for our industry right now. Packaging is a big part of that. So 41% of operators say they've made the switch to new takeout packaging, whereas 59% have been able to continue using their original packaging. What we know is important is that tamper-proof and sealable packaging is something consumers are looking for. So it could be as simple as using like a little sticker to close a clamshell package, so you know that your delivery person wasn't touching your food or eating a fry when they brought it on their way to you, as far as making sure that that's a tamper-proof experience. And then we've also asked the operator community, what methods have you put in place during this time that have been effective, and which will you continue doing once we're through this pandemic? And updated food safety procedures are that number one thing. So we don't think these new procedures are going anywhere at all. Consumers are looking for them, and also operators find that they've been the most effective change they've made during this time, and they tell us that they will continue doing these new procedures and practices and safety efforts once we're through this pandemic. Just a quick note about chains versus independents. So we saw at the beginning, very interestingly in March, that we asked consumers, do you feel more comfortable or safe eating at an independent versus a chain restaurant? Back in March, it was very clearly leaning toward independent restaurants, and that's because probably a number of things. You might know the staff and feel comfortable. You might know the family who runs it and feel safe going to an independent versus a chain back in March. In June, we did see chains gain a little bit more preference, and now today we're around a 50-50 split of chains and independents feel equally safe. So that's quite a material change in a short amount of time, just a couple months, and really gives a nod to the great work that chain restaurants have done to adapt to this changing environment and effectively communicate those precautions and new procedures to their consumers. One issue perhaps with independents is consumers feel like independents don't offer delivery as commonly as chain restaurants might, so that lack of access might be keeping consumers away from independents. And then we also find lower on this list here is younger consumers are more likely to experience issues ordering from an independent website. So it's maybe not as seamless as or easy for them to make those orders from an independent as compared to a chain. And then when we think about food preferences in this pandemic, reason for choosing a restaurant, we know that craving and routine are kind of the two key things still. They were certainly important before this. They continue to be important. The top reason for choosing a restaurant is they have the food that I like, so they can satisfy a craving that I have. I know I'm going to be satisfied with this meal or meal occasion, but then also fitting in our routine. So something being our usual place is that number two reason for choosing a restaurant during this time. And then as we think about how consumers are kind of shifting the way they eat and maybe what they order, we do think there's a unique opportunity right now to change that day part curve. So we used to really all have a schedule that's probably different than it was today. Certainly I did. I can speak with my own experience about that. So, you're not going for lunch probably right at noon anymore, nor do you need a dinner reservation at a certain time. So here we're asking which of these activities do consumers plan on maintaining after the restrictions are lifted. So washing our hands before eating, which is great, bringing hand sanitizer with us, but also avoiding peak busy times at restaurants. So again, maybe you don't need to have lunch right at noon. You can wait until 2 o'clock, or maybe you want to go earlier, for example. And there's also interesting conversation happening here about maybe dynamic pricing models at restaurants where consumers can be incentivized perhaps to have a 5 p.m. dinner reservation versus a 7 p.m. reservation. And although seating is limited in the restaurants, maybe we can keep guests inside the restaurants for a longer period of time throughout the day. And then what consumers are ordering during the pandemic, wanted to touch on this. So entrees, we know if we think about food costs that entrees have the highest food cost probably of any other item on our menus. And entrees happen to be what consumers are mostly ordering these days. Whereas we can see other parts of the menu, like a side dish or a beverage or an appetizer, are what people are ordering less of. So entree might have 40% food cost, beverage might have 10% food cost. So we're losing margins here. And we think, the conversation is now about kind of getting people through the door and making sure guests are coming in. But we think, the industry will need perhaps some guidance on how to help guide folks and what they're ordering and what they're looking to restaurants for to make sure that they are continuing to order these profitable items from the menu too. And then lastly, we have a syndicated food and beverage tracker that tests for everything we can eat or drink about how much people like it and how often they want to have it. And we pivoted this summer. So we fielded this in June and July, wanting to know what items consumers are craving and which items they want to have at home versus away from home during this time. So here on the left, these craveable items kind of are always going to be craveable items. Your identifiable favorites like a cheeseburger or a steak or a pizza. But things that we want to get away from home skew a bit more toward global foods like Japanese foods or sushi rolls or chalupas. So sort of two notable tidbits here is that what they want to get away from home are kind of globally oriented foods, and also foods like a sushi roll or a chalupa, which requires frying, that requires prep methods that we might not have at home. And building on that, the foods that consumers tell us they're most excited to get from restaurants definitely skew in a similar way. So Chinese food and sushi and soft serve ice cream, soft serve, which again requires that special machine, top the list there of what people really want to get away from home. also, again, like the items that are hard to prepare. I love lobster. I've never prepared it at home, but people are excited to get lobster and lobster rolls from restaurants right now. And then what we also noticed here as we kind of analyzed this data about what people want at home or away from home, to get some key themes, is that these being category averages, it really became clear kind of here what people really look to restaurants for. So what they look for is different cuisine types, different global entrees, and different global appetizers. So global is kind of that key notion. That's what folks are going to away from home operators for, and innovation is a big part of this. So we saw in the beginning of the pandemic, people wanted comfort foods and craveable favorites, but we know that people are looking to restaurants for global foods and cool new innovations, whether it's a new cuisine or something like that. So innovation is an important thing for us to think about too, and innovation is really how food service is going to continue to win and come out of this in a positive way. So just to quickly wrap up, kind of 3 key things to remember from the presentation is really safety trumps everything else right now. We have moved from a state of fear that we were in earlier in the pandemic to more of a state of caution today, but that doesn't mean we're not being careful. We are being very careful, and we're looking to restaurants for safety cues about the care that they're taking to make sure their guests remain safe. And we're also seeing accelerated adoption of lots of different things in our industry, whether it's contactless payment or new meal times offered at restaurants or lots of other things. So with that, I'll thank you and bring it back to Greg and the team here. And I think we have time for some Q&A.
Excellent. Thank you so much, Marie. Great insights. So now we're going to move into the Q&A portion. So if you haven't sent questions in and you do have them, please feel free to go down in the lower right-hand corner and enter your questions. I do have a couple here that have come in, and I think, Marie, since you just finished, I'll start with you first. We've got one that says, can you tell us what you see as the biggest shifts in consumer behavior and attitudes since April? Kind of a 2-part question. And do you think people are feeling more or less cautious in the midst of the rising cases?
Sure. Thank you, Greg. That's a good question. You know, we do think that generally our population has moved from a fear state to more of a caution state. That said, we definitely think there's going to be a baseline of fear that remains here until our situation stabilizes a bit. So nothing has stabilized yet. We have changing variables all the time. We saw that with increased cases. We saw fear increase. And with school starting, we saw fear increase. So definitely hard to say and predict what the future will look like. But we do think we're less fearful and we're more in a cautionary mindset today than we were months ago. And definitely, I think that the idea of contactless is going to be important moving forward. Lots of restaurants have already implemented contactless payment and contactless ordering, and we hear from consumers they like that. They find it preferable. You know, they can go pick up their food at their doorstep without having to interact with anybody. You know, they like these options. So contactless is a key thing, I think, as we think about the future. And again, that notion of overt sanitation, I think, is also important. It's like you can't be too obvious about what sanitation and cleanliness methods you're taking today.
Excellent. Thank you. Ruth, Dr. Ruth, we have a question here for you as well. What is the likelihood of a second wave hitting in the fall-winter season?
Oh, I wish I had a crystal ball. You know, I think the reality is here in the U.S., you know, we have plateaued generally. There certainly are pockets and different incidents around the country, but in general, we've kind of hit a leveling off point. We certainly spiked pretty dramatically over the summer in parts of the U.S. I think the reality is that if we want to have, or if we're looking for a second wave, we've got to have a pretty dramatic decrease. And we're just not there yet. I think what's more likely to happen, frankly, is that we will continue at this perhaps steady state, perhaps some decreases, but with the realities of kids going back to school, colleges reopening, we have more realities of just people gathering because of those activities. I think things are more likely to remain flat with some blips here and there associated potentially with some of these gatherings where people are paying a little bit less attention. That said, there are other parts of the world where there have been more dramatic kinds of decreases in incidence, and we may see some creeping back up of numbers there. Schools are opening around the world, so that's a potential risk really everywhere. So I think what's most key is that we remain vigilant, because this is not going away tomorrow, much as we would all like it to. So we need to keep paying attention and performing those kinds of behaviors that hopefully have become a little bit second nature, but admittedly are hard to do.
Great, thank you. Katie, do we have a few other questions coming in?
We do. Here's a question that I think is geared for Dr. Ruth. The question is, I've read that directing a laser thermometer at a forehead is ill-advised due to the pineal gland. I've found that pointing the device at the wrist works just as well. Any thoughts on this?
Well, I think what's most important is to follow the guidance from the manufacturer of the thermometers. The pineal gland is a part of our brains. That's about all I know about it. And, there has been a little bit of chatter out there that aiming a laser thermometer at your head where that gland is can potentially cause damage. And that has largely been disproven and kind of an urban myth, so to speak. If the device manufacturer and you're finding that aiming this at the wrist is effective, that could certainly be an option. But I think the risk to human health that's kind of inferred in this question is just not proven out.
Great. And I have another question. Can you please give some more information about using UV as a disinfection tool for COVID-19? We get a lot of questions about this. It is challenging to explain why our products and systems are more appropriate to use if we don't know the information about UV.
Sure. Yeah, this is one of those emerging areas of a lot of research, and I don't think we have a definitive real answer on this yet, but research is ongoing. We do know from past experience with like kinds of viruses to the one that causes COVID-19 that UV may provide some degree of inactivation, but whether it's a good enough level based on the level of viral particles that might be there, we don't know. It's also really important to keep in mind that the way UV devices are regulated in the U.S. is a little bit different than a standard chemical kind of disinfectant. The EPA, Environmental Protection Agency, regulates disinfectants, and it's required by manufacturers that they provide data to EPA to demonstrate that this chemical is going to inactivate the target microorganism, like the virus that causes COVID-19, to a significant level, and therefore its effectiveness is verified. A device manufacturer, such as would be emitting UV, is not required to have that kind of data vetted by a body like the EPA. So while the EPA would approve the device itself, it doesn't approve the output of that device. So it's really up to each manufacturer to generate their own data and prove it to you as a buyer or a user of this unit that it's working effectively. So it takes some technical expertise to be able to assess that data appropriately. I think the standard information I'd think about today is that UV may have some value, but it, in my mind, in no way replaces our doing any of the other kinds of things we're supposed to be doing. It may be a good adjunct to, the standard chemical-based cleaning and disinfection, but we also need to keep in mind that we need to be practicing that isolation of ill people and physical distancing and wearing of masks, and all of that collective risk management strategies have to be all done in concert. UV is not a magic wand here that we can wave or shine and get rid of all of the risks that may be presented.
Great. Let me just make sure that I don't see any other questions coming through here. Oh, yes, 2 more questions. This question could be interesting to get both of your perspectives, Marie and Dr. Petran. Do you believe that self-serve buffets are gone forever?
I guess I can speak to the data here. We have asked about different methods of getting food that consumers feel uneasy about, and it's very clear that the self-serve options will need to be reworked. They are exactly the methods that people are nervous to go to today, so salad bars and hot bars and soup pots and all of that definitely are not something consumers feel safe using in large part. So definitely, I think they will need to be reworked. We've seen some cool innovations happen, like grocery stores around the country are using robots, actually, like a salad robot that can mix you a fresh salad instead of having to go to the cold bar in a restaurant. So that's one example, and I think we'll definitely continue to see innovation. I don't know what it would look like. Again, I wish I had a crystal ball, but we do know that that's the type of food service that consumers do feel definitely most uneasy about today, self-serve.
Yeah, and certainly the data bear that out. But I do think, to Marie's point, that there are ways that buffets can be operated safely. Whether it's, to the degree of some of the real innovative kinds of new technologies that are out there, certainly could be one direction. But I think paying attention to, again, the standard risk management practices, avoiding people crowding around those buffets, limiting kind of the people going through the line. And I think there are ways to do that effectively. Making sure that the utensils for serving are switched out very, very routinely. Maybe putting a hand sanitizer dispenser right at the entry to the buffet so that people are prompted to use that, and perhaps even putting a staff member there to encourage guests to be using that hand sanitizer prior to their going through that buffet. Clearly, one needs to be very careful about their own risk levels, but I do think there are ways that we can get back to some of these activities like a buffet, as long as we think about what risk management strategies we need to put in place.
Great. And I think just one last question. Which is, with companies' staff working from home, there must be fear from food service operators that customers will not be coming back to the office. And would you expect these numbers to change when a vaccine becomes available?
Hopefully. I think the reality is that probably will be true, but the vaccine is not going to be available, I don't believe, on a widespread basis for quite a while. Yes, there's certainly a lot of vaccines that are in progress right now, and it's likely we will start to have some people be able to be vaccinated, say, by the end of the year or thereabouts. But there are billions of us in the world who need to get that vaccine. And just the reality of getting to that many people takes time. So
right.
I think we just need to keep that in mind.
Yeah, we definitely know some meal occasions will change, business lunch being a big one. We've seen some operators like Specialties, they were built around that concept and they've since shut down because business lunch has changed. And also, of course, traffic is down across the industry. I think about myself, I'm 10 feet from my fridge right now, so it's super convenient to have lunch at home versus, I used to maybe be more likely to go out to eat. So I hope our habits change. We'll be back in offices in the near term, but unsure how that's going to look or what that timeline is going to look like just yet.
And I think that may be it for the questions that we can get to today.
Perfect. Well, thank you. I really just want to say thank you, Marie, to you and to Dr. Ruth for participating in the session. Thank you to Informa, Nation's Restaurant News, to Sarah for your partnership here to help put this together. And I want to thank the attendees for participating today. Thank you for taking the time out of your day to participate. We really appreciate that. Next week, I just want to draw your attention to our series next week. We've got a food safety series that will be focusing on health inspections, right? Stephen Mandernock, Sandra Craig, Elizabeth Wiring, veteran experts in the field of food safety, moderated by Ecolab's Mandy Sedlak. So please, if you can, register for that event. And then obviously we've got the week 3 and week 4 webinars as well. So with that, we'll close. And again, thank you for attending. Enjoy your afternoon and look forward to talking more soon. Bye now.